afternoon or morning, listeners of the Maryland World Health Association's Voice of Rural Health podcast. Welcome back in. I appreciate you tuning in to listen. I have a great guest on this morning, Dr. Eric Weintraub. Dr. Eric is going to give his introduction. Welcome.
Thanks, Jonathan, for having me on the podcast. I am Eric Weintraub. I'm a physician. Currently, I'm a professor of psychiatry at the University of Maryland School of Medicine, where I've worked for over 30 years. My major role there now is as the director of the Division of Addiction Research and Treatment, and I'm responsible for running the clinical programs that come out of the University of Maryland and our access programs, and also I'm engaged with education of individuals about addiction and also research as well. So, and really nice to meet you, Jonathan.
Well, I appreciate you being on the air today, and I know that you're here kind of representing MACS, which is the Maryland Addiction Consultant Services. And can you go over their mission and how do you and your colleagues support healthcare providers, really across the state in addressing some of the most pressing issues like substance use care and chronic pain management?
Sure, Jonathan. So MACS, as you said, is the Maryland Addiction Consultation Service. And we've been operating for several years now. It's a state-funded program, so we receive money from the Behavioral Health Administration. And our goal our original goal was really to educate primary care physicians on how to use medications for opioid use disorder, specifically buprenorphine, to treat patients. As you know, we're in the throes of a terrible opioid epidemic, and the gold standard treatment is our medications for opioid use disorder. And what we were seeing was there was an underutilization of this gold standard treatment in underserved rural areas. So we put together this program to provide support and education to physicians in the field who were taking care of our patients that had opioid use disorder. Over the years, the program has expanded. We were focusing more on just the MOUD and buprenorphine, but we started getting asked questions about substance use in general, chronic pain, and the interaction between chronic pain and the use of opioids. And so now we actually take questions. We have a 40-hour a week warm line that we call it, where we can take questions about any topic related to substance use. We also offer a wide range of trainings and consultations and technical assistance to individuals. And these include webinars on particular topics related to different addictions. And we also provide consultations about patient care. And these consultations are not actually, they're de-identified data. So we give general advice on how to care for individuals with opioid use disorder. So we get calls from people that are new to taking care of individuals with substance use disorders, but also experienced practitioners that are checking in on relatively complex cases. We have a whole wide range of specialists, including addiction psychiatrists, pharmacists, perinatal and adolescent addiction medicine experts that are available to talk to clinicians who are caring for patients and have questions. We also do, in addition to webinars, we have other types of educational offerings, including, but I'll talk a little bit about that later. So thanks. Hopefully that answers the question.
That most certainly answered my question. And obviously, with rural providers all across the country, but here in the state of Maryland, any additional support that can be offered to them as they treat patients, definitely that have a variety of diseases and ailments and conditions. I think that, your services are very important. And you mentioned some of your educational services, which we most certainly can dive into later, because I want to make sure that we highlight those resources for the listeners of the audience. But, my next question for you is, really related to those rural communities. And obviously, across the country, but here in Maryland, they face very unique challenges in addressing specialized healthcare services. So how does MACS kind of bridge that gap in healthcare resources and addiction care capabilities for providers in those rural communities, Eric?
Yeah, that's a great question. So we've seen that there are workforce challenges in rural areas, and there's a variety of reasons for that. But over the past 15 years, multiple hospitals have closed in rural areas. There's workforce shortages in a variety of medical specialties. One example would be close to 50% of the hospitals in rural areas do not offer obstetric care. And when we first started providing this access program and support to individuals, we were focused on underserved rural areas because we knew at the time there were workforce shortages, a lack of providers that could prescribe medications like buprenorphine, which are the gold standard, as I mentioned before, treatment for opioid use disorder. I mean, there's studies that demonstrate that people on buprenorphine and methadone, which are the medications that we use to treat opioid use disorder, their rates of overdose death can drop by up to 80%. So our goal was to focus and work with primary care physicians in really rural areas, because primary care physicians in rural areas have a lack of support and are asked to do a lot more than those in urban areas. So because of the lack of other resources, they have to frequently provide pediatric care, obstetrical care, addiction care, and it's really quite complex. They have a very complicated, hard job. The other thing is there's a lack of other types of providers in rural areas. So we have less social workers, we have less counselors, we have less addiction programs, or even issues with pharmacy access. So we try to provide support in all of those areas so that patients with opioid use disorder can get the appropriate care that they need, and people, actually patients with any kind of addiction disorder can. So MACS is able to take calls, not only provide support for individual patient care, give advice on how to develop standard operating procedures, on how to take care of patients with different types of addiction orders, handle questions about complex questions about individuals with addiction disorders with all of our experts. So if we get a call, for example, about an adolescent with an addiction disorder, we have somebody we can go to that can really address that issue. If we have somebody that has a chronic pain issue and addiction, we have a chronic pain expert who is trained in that area. So we really feel like we're able to provide support for any type of question. The other thing that we developed was we started working developing an ECHO program, and Project ECHO is a program that was originated at the University of New Mexico by Dr. Sanjay Arora, who developed a video-based learning community model specifically to connect primary care providers in rural areas with the academic hub of the university. So this is a way of pumping out our expertise in an academic setting to the rural areas. And we employ this model to bring together a community of learners across Maryland to acquire best practices from each other as we collectively work together to address the needs of individuals across the state. At the present time, we have 4 ECHO clinics running, and they deliver an opportunity for healthcare teams to come together and present de-identified cases from their clinics. So they'll choose a complex or maybe even a common case that we can all learn from. These clinics are geared toward primary care providers treating substance use disorders, providers working in opioid treatment programs, individuals in mental health settings, in maternal health settings, and providers interested in expanding their knowledge of about prescribing MOUD from a trauma-informed perspective. So we have these 4 different echoes going on. We have a cohort of providers that come in, discuss cases, and we learn together.
Well, thank you, Eric, for that really robust overview. And I think you hit the nail on the head a couple of times when you mentioned the workforce and providers in rural communities really kind of doing a lot of extra things to care for their patients due to the lack of resources, which is something that here at MRHA we're looking to kind of help maybe push through some legislation here in the upcoming session to help address. And obviously too, I think that I call it the toolbox, right? It sounds like MACS is really an extension of services for providers that really need extra resources with folks that are dealing with SUD disorders and other particular ailments and diseases. And I think that that's important for folks to realize that are listening that this is, the resources that you have available to them are really extensive. And so to make sure that the resources that you have at MACS are known to the provider population across rural Maryland, I think is, really important. And you hit a little bit of this, but can you maybe touch a little bit on the emerging trends or challenges, and even opportunities in substance use that you've recently observed? And are there any implications that you think providers in rural communities will need to be aware of?
Yeah, so again, that's another really wonderful question because so I think there's a lot of emerging trends. I think one of the biggest ones, which has been going on a long term for a long time, is since 2000. So emerging in the sense that it was new then, is that rural areas have been hit much harder by opioid use disorder, and that has to do with the distribution networks of how opioids are distributed. Used to be that they came through port cities and had traditional sort of the way that through a drug cartel type setting where people would they come through the port and then drug dealers would sell them on the streets. But now you can get drugs through a variety of mechanisms, ordering them online. So they've spread around to rural areas, and rural areas did not really have a treatment infrastructure in place. So that's been a big issue that we've gotten overwhelmed in rural areas by the increase in use. The other, and this is related to a change in which individuals were usually naturally occurring substances that were grown in plants. Now, almost all the drugs of misuse are synthetically created, which has created a lot of issues, including potency. So now fentanyl is a synthetic drug. Methamphetamine is a synthetic drug. So people can make these anywhere. Other trends are that recently we've seen a lot of other drugs being mixed with opioids and methamphetamine and cocaine, things like xylazine, which is really a veterinarian drug that can cause extreme wounds and sedation and impact your ability to respond to opioid reversal drugs like Narcan. So every day we read about new trends, new drugs. The chemists are now in control of what types of drugs we're seeing on the streets and not the farmers. So it's really a dangerous time because the drug supply is so toxic and dangerous, and individuals that are on the streets don't know what they're taking anymore. They buy a drug that's called dope, and it could have several different types of substances in it. So it's really made using drugs a dangerous game. It's always been dangerous to use heroin, but now with fentanyl and other really highly potent drugs that are mixed with other synthetic substances, the drug supply is as toxic as it's ever been.
Yeah, and I'm glad that you mentioned a couple of things there. And one, I think the infrastructure in rural communities, again, wasn't prepared. And, I live in a rural town, rural city, and, substance use has taken over in, the past 10 years. And it's gotten to a point where it's pretty prevalent, basically all over the city, where once it was more, that inner city type of conditions, now it's spread to those rural outlying counties and cities all across Maryland that, are not close to DC, not close to Baltimore. So it's definitely a problem all across Maryland. And folks, traditionally don't realize that Maryland's considered 75% geographically rural. And so it does impact a lot of Maryland residents that live in these rural communities. So I'm glad that you had, mentioned that. And then additionally, too, you mentioned synthetics and not knowing what's in, that dope, right?
Yeah.
I don't know if folks know on the podcast that I'm a EMT as well. So I, go out and ride the ambulance on occasion, and we have to take extra precautions when, responding to overdoses, because we don't know, what, that patient had taken or what may be at the scene, or it's definitely a different world that we live in now. And so response from, emergency services all the way to the treatment in the hospital and then post-treatment as well is definitely taken a different avenue than it had in previous years. So I appreciate you, Eric, giving a really good, robust overview of the services that MACS has available. But then also too, I love the overview of, what do you think is emerging and some of the trends. And I wholeheartedly agree with basically everything that you have said. So I want to make sure that folks, really know how to get in touch with you and your team so that if a provider needs to do a consult with you, how would they reach you, Eric, or a member of your team?
Yeah, and I did want to say right before I say that we talked about the providers, but we have a tremendous operational team too, the people that handle the calls and make sure this program runs efficiently and well. And to get a hold of those individuals, to reach the MACS warm line and connect with a consultant specializing in substance use disorder and chronic pain management, you can dial 1-855-337-MACS, and MACS is 6227. For information about MACS services and to register for an echo clinic or an additional free virtual training, visit the MACS website at www.marylandmacs.org. And to stay up to date with MACS educational offerings, and partner programs, follow at Maryland MACS. Again, that's at Maryland MACS on Facebook, Instagram, and LinkedIn, and at Maryland_MACS on X. I think I got all that.
I know there's so many social medias and handles nowadays that that all gets confusing, but we'll make sure that we put those in the comment section of the podcast so that folks can refer back to them. And obviously, too, we'll make sure that we promote them out there on our social medias as well, because we want folks to really know the services that you have available to clinics and providers, because I think that the one thing that here at MRHA we're really a priority for us is to make sure that everyone's educated on all the services that are available to them for the clinics and providers of these rural communities. So again, thank you, Eric, for being on the Voice of Rural Health podcast here at the Maryland Rural Health Association. And we look forward to continuing to work with you and MACS here in the future.
Thanks, Johnson. Keep up the great work.